Greetings. My name is Korrey Monroe, and for my 2020 McNair Scholars Research Institute research project, I decided to do Discrimination and Challenges, Black Communities in the United States Healthcare System. So here's my abstract. This research project examines the various areas of discrimination and challenges that Black communities face within the healthcare system of the United States. Through an extensive search of existing literature, including social sciences and medical journals, this paper focuses on the areas within the United States healthcare system in which discrimination and challenges are present for the Black community. Implicit bias and racial disparities have led the healthcare system to provide a low standard of service to Black communities. In this research, I sought to explore how has the healthcare system changed, what challenges and discrimination does the United States healthcare system present to Black communities, economically, accessibility-wise, and the different health conditions, and what are the specific challenges around mental health provision for Black communities. Purpose of study. So as a public health major and an African American, African diaspora studies minor, I wanted to really explore the ways in which the United States healthcare system has, shaped to Black communities and has really been involved with Black communities. So the first purpose of my study is to examine the discrimination and challenges that are presented to Black communities through the United States healthcare system, to explore the ways in which the healthcare system has evolved in Black communities, to expose the bias against Black communities in the United States healthcare system, as well as to uncover areas for future research. Methods of research. The methods of research that I used were research questions, which were: how has healthcare changed? What challenges and discrimination does the United States healthcare system present to Black communities? And lastly, what are specific challenges around mental health provision for Black communities? I then did an extensive amount of research with multiple academic databases. These databases were not just academic databases. These databases were also from medical facilities, medical organizations, and things of that nature. I then did an annotated bibliography, which helped me to write the literature review. My topics fall into different factor groups. So for the social factors, we have historical perspective and diversity and discrimination. For economic factors, we have career fields and economic connection. And lastly, for health factors, we have general health problems in the Black community and mental health. These factors are the subsections of my literature review. So going more in depth into the social factors, first we have historical perspective, and my findings were that there is insufficient research on historical imbalances in the healthcare system for Black communities in the U.S. Cases such as the Tuskegee syphilis experiment and Henrietta Lacks cancer cells portray the roots of injustice. Black communities were treated as guinea pigs instead of humans. Diversity and discrimination. The Black community is diverse and needs more research catered to the dynamics of the community. Those of the LGBTQ community need more research focused on diseases outside of HIV and AIDS. For the economic factors, economic connection. Economic factors play a big role in healthcare. Black communities are not able to access healthcare facilities due to the absence of facilities in their areas. The rate and cost of insurance is not affordable for Black communities due to the low salaries and wages that jobs supply their employees with. Career field. Black medical professionals are not presented with the same opportunities when compared to other races within the field. The salaries and career projection of the Black medical professionals are also lower. Medical programs and institutions have a lower acceptance rate when looking at the Black population when compared to other races within the program. Research lacks in gender-focused data within the Black medical professional field in order to expose and understand discrepancies between the two. Health factors. General health problems in the Black community. For the multiple health problems that the Black community faces, there is a lack of research and methods of prevention to slow the rates of increase in the conditions. These conditions consist of cardiovascular disease, heart disease, and diabetes, and there's a lot others. There is a lack of research focused on these conditions that result in death. Mental health. There is a lack of general awareness in the Black community. This lack of awareness roots from the lack of information and accessibility to facilities in these areas. More research and facilities are needed in this area of research. In the fall 2020, this project will be contributing to another project titled Ethnic Diversity Within Black Populations in the U.S., and that is sponsored by the URCA program of UNCG. Special thank yous to Dr. Haywan Germa, Sam Harlow, the McNair Scholars Program, the Digital Ag Studio, and Christy Ellison. Thank you.